Cornea. Special investigations for cornea. Keratometry. Principle. Anterior surface of cornea acts like a convex mirror. Size of image is inversely proportional to curvature. Image seen as keratometric mirrors. Correct positioning of mirrors. Single overlapped plus sign. Keratometric mirrors used. Measure corneal curvature. Diagnose astigmatism. Horizontally oval mirrors with the rule astigmatism. Vertically oval mirrors against the rule astigmatism. To ascertain proper fitting of contact lens, to diagnose keratoconus, pulsating mirrors seen. Good fit of lens, steep fit of lens. Pachymetry measures corneal thickness. Normal corneal thickness 0.5 to 0.6 mm. CT is the highest in the center. Corneal thickness is highest in the center. Reduced towards periphery. Uses eligibility for LASIK. Contraindicated if corneal thickness is less than 450 micrometer. Intraocular pressure measurement. 1 mm Hg intraocular pressure equals to 10 micrometer of corneal thickness. So if corneal thickness increases, falls high intraocular pressure, and if corneal thickness decreases, falls low intraocular pressure. Corneal topography, examination of corneal surface. Methods use Placido disc. Ewing aperture with lens. Reflection rings handle. Reflection of Placido disc normal. Orb scan uses slit scan imaging principle. Pentacam measures corneal thickness, corneal curvature, anterior segment imaging, topographic evaluation maps of anterior surface, topographic evaluation maps of posterior surface. Corneal vital staining used to visualize and distinguish ulcer from healthy tissue. Fluorescein dye stains area of denuded epithelium. Floor base of ulcer visualize under cobalt blue light. Green fluorescence stain in floor base and margins. Cornea. Other uses are Goldsman applanation tonometry, Doan's dye disappearance test, lacrimation assessment, Seidl's test in penetrating trauma, Rose Bengal dye. Stains devitalize necrotic tissue, margins of ulcer. Disadvantage can be toxic to healthy tissue. Fluorescein dye application. Lysamine green dye. Stains devitalized damaged tissue. Advantage non-toxic to healthy ocular tissue. Other uses most common used for diagnosis of dry eye by conjunctival staining. Alcyon blue dye. Stains mucin deposits and filaments. Other corneal investigation, confocal microscopy, non-invasive technique for in vivo imaging of all layers of living cornea. Corneal esthesiometer examines corneal sensations. Instrument, pen-like instrument with filament, 6 cm long, length of filament eliciting corneal sensation, directly proportional to corneal sensations, indirectly proportional to anesthesia. Corneal ulcer and keratitis. Discontinuity in corneal epithelium plus cellular infiltration and necrosis of underlying layers. Bacterial corneal ulcer. Etiology, Staphylococcus ulcer, aureus, most common worldwide. Pneumococcus, most common in India. Ulcer serpines, center, periphery in zigzag patterns. Hypopyon corneal ulcer. Corneal ulcer, hypopyon, collection of pus in anterior chamber. Pseudomonas, most common in contact lens user, green discharge. Atypical mycobacteria, most common in history of LASIK. Nocardia, wreath-shaped pinhead ulcer. Bacteria invading intact epithelium. Neisseria meningitis, Neisseria gonorrhoeae, Corynebacterium diphtheria, Listeria, Shigella, Haemophilus aegyptus. Wreath-shaped ulcer, which is caused by nocardia. Pathogenesis stage 1, initial stage. Saucer shaped ulcer with overhanging margins. So that is stage 1. Stage 2, progressive stage. Infiltration by polymorphonuclear cells and hypopyon, keratouveitis, mobile, liquid-like pus, and sterile. That's stage 2. Still sterile. Stage 3, regressive stage. Smooth floor and edges of ulcer, vascularization present, decreased inflammatory response. Stage 4, scar cicatrization, permanent vision loss after the scar formation. Stage 4, cicatrization. Complications, ectatic cicatrix, thinning of cornea, bulging of cornea due to increased intraocular pressure, temporary or permanent, lobulated appearance of anterior staphyloma, descemetocele, pseudocornea and iris prolapse are seen. Anterior staphyloma, bulging of cornea due to thinning of and incarceration of iris tissue. Descemetocele, herniation of descemet membrane through corneal ulcer. Perforation of cornea, aqueous leak, increased intraocular pressure, iris prolapse. Pseudocornea, corneal surface formed due to plugging of perforation by iris tissue. Endophthalmitis, pendendophthalmitis management, antibiotics. After gram staining and culture of ulcer base and scraping, fortified antibiotics, fortified cephalozine 5% plus fortified tobramycin 1.3%. Atropine eye drops relieve ciliary spasms. Impending perforation, oral doxycycline, soft bandage contact lens, cyanoacrylate glue. Contraindications, steroids due to epithelial thinning. Fungal corneal ulcer, most common cause is Aspergillus. Filament fungi with separate hyphae. History of trauma with vegetative fungi. Signs, out of proportions to symptoms. Dry looking ulcer, feathery ulcer margins, satellite lesions, Weasley immune ring, antigen antibody complexes. Hypopyon, thick, immobile, asterile. Fungal corneal ulcer. So number 1 is the feathery ulcer margin, number 2 are the satellite lesions, and number 3 is the Weasley immune ring. Signs are out of proportional to symptoms. Treatment, antibiotics, netamycin 5% eye drops, drug of choice for Aspergillus fusarium. Amphotericin B 0.15% eye drops. Atropine supportive treatment, steroids contraindication. Acanth amoeba keratitis, risk factor. Unhygienic practices in contact lens users, contaminated solution using tap water, swimming pools. Clinical features, symptoms out of proportions to signs, pseudodendritic keratitis, radial keratoneuritis, inflammation of nerves throughout cornea, ring-shaped ulcer with abscess, pathognomic. Investigation, gram staining, double wall acanth amoeba cyst. Culture media, non-nutrient agar enriched with E. coli. Treatment: drugs inhibiting membrane synthesis, PHMB. Polyhexamethylene biguanide, drug of choice, 0.02%. Chlorhexidine, 0.02%. Drugs inhibiting DNA synthesis, propamidine, most common. Viral keratitis, herpes simplex virus, primary infection, conjunctivitis, recurrent infection, keratitis. Clinical features: epithelial lesions due to active viral replication, fluorescent staining, superficial punctate dot-like keratitis, dendritic ulcer branching with terminal buds, geographical ulcer. 3% acyclovir eye ointment 5 times a day for 10 to 14 days. Steroids are contraindicated. Note: other differential diagnoses for dendritic ulcer are acanthamoeba amoeba keratitis, herpes zoster virus keratitis, tyrosinemia, contact lens overuse. Stromal keratitis, immune stromal keratitis due to type 3 hypersensitivity, occurs following epithelial keratitis. 3% acyclovir ointment plus topical steroids. Central stromal tissue, necrotizing stromal keratitis, most severe form of stromal keratitis. 3% acyclovir treatment plus topical steroid. Endothelial lesion, disciform keratitis, disc-shaped areas of deep stromal endothelial edema, type 4 hypersensitivity reaction. Hallmarks of herpes simplex virus keratitis, corneal anesthesia. Metaherpetic keratitis, neurotrophic ulcer due to fifth cranial nerve palsy. Herpes zoster ophthalmicus shingles, affects dermatome supplied by ophthalmic branch of fifth cranial nerve, Hutchinson's sign, rash involving the tip of nose, increased chance of herpes zoster ophthalmicus. Clinical features: pseudodendritic ulcer, branching pattern with no terminal buds, nummular keratitis, mucus plaque keratitis in chronic cases, stromal keratitis, cranial nerve palsy, third cranial nerve most common, sclerokeratitis least common finding, postherpetic neuralgia, persistence of pain after 1 month of resolution, worse at night. Treatment: tablet acyclovir 800 mg 5 times a day for 2 weeks. Coin shaped subepithelial tissues, nummular keratitis.